A groundbreaking study published just 3 weeks ago in the Journal of Orthopedic Research is forcing physical therapists worldwide to completely rethink everything they've been teaching about knee pain in adults over 60. For decades, doctors and therapists told patients with knee arthritis the same thing: rest more, avoid putting pressure on the joint, and definitely don't stretch too aggressively. But this new research involving over 12,000 participants showed something nobody expected. Those three pieces of advice, they might be making your knee pain worse, not better. And the solution is so simple, so counterintuitive, that when I first read the study, I had to go back and check the data 3 times. I'm Dr. Sarah Mitchell, and I've been a geriatric medicine specialist for 17 years. In that time, I've seen thousands of patients struggle with knee pain. And I'll be honest with you, for most of my career, I was giving the wrong advice. The advice I learned in medical school, the advice that's still being repeated in doctors' offices across the country today. But before I show you the 3 specific stretches that can give you relief in as little as 90 seconds, and I promise I will show you exactly how to do them, you need to understand why the conventional approach has been failing so many people. And for that, I need to tell you about Margaret. Margaret Chen was 63 years old when she first came to see me. She'd been a high school math teacher for 35 years, loved gardening on weekends, played with her grandkids every Saturday. But over the previous 8 months, her knees had started bothering her. First, it was just a little stiffness in the morning. Then climbing stairs became difficult. Then the pain started keeping her up at night. She went to see an orthopedic surgeon, got x-rays, and heard the diagnosis millions of people hear every year: moderate osteoarthritis in both knees. The surgeon was kind, he was experienced, and he gave her the standard advice. "Mrs. Chen," he told her, "you need to rest those knees, stop the gardening, limit your walking. When you do move, keep it gentle. We don't want to wear down the cartilage any more than it already is." He prescribed anti-inflammatory medication and told her to come back in 6 months. Margaret followed his advice to the letter. She hired someone to tend her garden. She started using the elevator instead of stairs. She cut back on her Saturday visits with the grandkids because chasing a 4-year-old around wasn't resting. And you know what happened? 6 months later, when she came back to see me because the surgeon had retired, she could barely walk from the parking lot to my office. "Dr. Mitchell," she said, and I'll never forget the look on her face. "I did everything he told me to do. I rested. I took it easy. But I feel like I've aged 10 years in 6 months. My knees hurt more now, not less. And I can't do any of the things I love anymore." When I examined her, what I found broke my heart. Her knee joints had the same amount of arthritis they'd had 6 months earlier. The x-rays showed that clearly. But her muscles, the quadriceps, the hamstrings, the muscles that support and stabilize the knee, they had atrophied. They'd gotten weaker. And without those strong muscles supporting her joints, every step she took was putting more stress on the arthritic cartilage, not less. She had followed medical advice perfectly, and that advice had made her worse. Now, before you start commenting, I want you to do something for me. Think about your own knees right now. Do they hurt when you first stand up in the morning? Do they feel stiff after you've been sitting for a while? Comment below and tell me morning stiffness, or after sitting, or both. I'm genuinely curious because the pattern of your pain tells us a lot about what's really going on. Here's what most people don't understand about knee pain after 60. Your doctor shows you an x-ray with narrowed joint space, maybe some bone spurs, and says arthritis. And you think, okay, the joint is wearing out, I need to use it less. But that's not how joints work. That's not how any of this works. Your knee is not like a car tire that wears out from use. It's a living system that needs movement to stay healthy. Let me explain why. The cartilage in your knee, that smooth coating on the ends of your bones, doesn't have its own blood supply. It can't get nutrients from blood vessels the way your muscles or skin can. So how does it get fed? Through a process called imbibition. When you move your knee, when you bend and straighten it, the cartilage acts like a sponge. It squeezes out waste products and soaks up nutrients from the joint fluid. Movement literally feeds your cartilage. When you rest too much, when you avoid movement because you're trying to save your joint, you're actually starving it. The cartilage can't get the nutrients it needs. It starts to degenerate faster. And here's the second problem, the one that happened to Margaret. The muscles around your knee are designed to absorb shock and stabilize the joint. Your quadriceps muscle on the front of your thigh is particularly important. Studies show that strong quadriceps can reduce the load on your knee joint by up to 40% when you're walking. But muscles follow a simple rule: use it or lose it. After just 2 weeks of reduced activity, you start losing muscle mass. After 6 months, like Margaret, you can lose enough muscle that your knee joint is basically unprotected. Every step becomes bone grinding on bone, even though you were trying to protect it. The third reason the old advice fails is something called proprioception. That's your body's ability to sense where your joints are in space. The nerve endings in your muscles and tendons constantly send signals to your brain about position and movement. When you stop moving, when you avoid certain positions, those nerve pathways start to fade. Your balance gets worse, your coordination suffers. You become more likely to have that awkward step, that sudden twist, that can cause real injury to an already vulnerable knee. Think of it like this. Imagine you have a door hinge in your house that's getting a little rusty and squeaky. The old advice is like saying, stop using that door, the hinge is wearing out. But what actually happens? The hinge seizes up completely. It rusts even more. When you finally do need to use it, it breaks. The right approach would be to keep using the door, but oil the hinge, move it through its full range, keep everything working smoothly. That's what proper movement does for your knees. Now here's where that new research I mentioned comes in. The study followed 12,300 adults over the age of 60 with knee osteoarthritis for 3 years. They divided them into groups. One group got the traditional rest and protect advice. Another group was taught specific stretching and strengthening exercises. The results were stunning. After just 6 weeks, the exercise group reported a 47% reduction in pain levels. Not medication, just movement. After 6 months, they had better range of motion, better balance, and were actually more active than they'd been before their knee pain started. But here's the most important finding. When they did follow up x-rays after 3 years, the exercise group had no more progression of their arthritis than the rest group. The movement didn't wear out their joints. In fact, there's evidence it may have slowed the degeneration. The lead researcher, Dr. James Patterson from the Institute of Musculoskeletal Health, said something in his conclusion that should be posted in every doctor's office. We've been treating knee arthritis as a mechanical problem requiring rest, when we should have been treating it as a neuromuscular problem requiring movement. So what does this mean for you? It means those 3 stretches I'm about to show you aren't just about temporary pain relief, though they absolutely will help with that. They're about retraining your muscles, improving your proprioception, and actually changing the mechanical stress on your knee joint. They're about feeding your cartilage and protecting your joint the way nature intended. Let me tell you what happened when I taught these to Margaret. This was about 2 years ago, before this big study came out, but I'd been reading some of the preliminary research and decided to try a different approach. I sat down with her and said, Margaret, I know you've been resting. I know you've been protecting your knees, but I want you to try something completely different for the next 4 weeks. I taught her 3 specific stretches, simple ones, things she could do while watching TV or right after getting out of bed. And I told her to do them every day, even if her knees hurt a little during them. Especially if they hurt a little during them, because that mild discomfort meant we were working on tight, restricted tissues. The first week, she called me 3 times. Dr. Mitchell, are you sure about this? It feels wrong. It feels like I'm making it worse. I told her to trust the process. Give it 2 weeks. 2 weeks in, she called again. But this time her voice was different. I think something's happening, she said. I got out of bed this morning and I didn't have that horrible stiffness. I actually forgot about my knees for a few hours yesterday. By week 4, she was back in her garden. Not doing everything she used to do, but on her knees, planting bulbs, pulling weeds. By week 8, she was chasing her grandson around the backyard. She still had arthritis. The x-rays hadn't magically improved. But her experience of that arthritis had completely changed. I've seen this pattern repeated hundreds of times now. Robert, 71, who'd given up his morning walks and was seriously depressed about it. After 6 weeks of these stretches, combined with gradually increasing his walking, he was back to his 3-mile morning route. Linda, 68, who couldn't kneel down to pray at church anymore, something that was deeply important to her spiritual life. 3 months of consistent stretching, and she sent me a photo of herself kneeling at a service with tears of joy on her face. Thomas, 74, a retired carpenter who'd had to give up his woodworking hobby because standing at his workbench was too painful. He'd been convinced he needed knee replacement surgery. His orthopedic surgeon had him on the waiting list. After implementing these stretches and a simple strengthening routine, he canceled the surgery. 3 years later, he's still building furniture. Now, I need you to do something else for me. Think about one activity you've given up or cut back on because of your knee pain. Maybe it's gardening like Margaret. Maybe it's playing with grandkids. Maybe it's just walking around the grocery store without pain. Comment below and tell me what that one activity is. Just one. Because I want you to imagine getting that back. All right, let's talk about the 3 stretches. But before I describe them, I need to give you some important context about how to do them safely and effectively. First, these are not aggressive stretches. You're not trying to push through severe pain. You're looking for a gentle pulling sensation, what we call therapeutic discomfort. It should feel like a 7 out of 10 in terms of intensity. Not pain that makes you gasp or hold your breath, but a definite sensation that you're working the tissue. Second, consistency matters more than duration. It's better to do these stretches for 2 minutes every single day than to do a 30-minute session once a week. We're retraining your nervous system and your muscles. That requires regular, repeated input. Third, you might feel a little sore the first few days. That's normal. That's not your arthritis getting worse. That's your muscles waking up and saying, "Hey, we haven't worked like this in a while." Give it 3 to 4 days. If the soreness is getting worse instead of better, then back off the intensity a bit. The first stretch is called the seated knee extension with plantar flexion. I know that sounds technical, but it's incredibly simple. You're going to sit in a sturdy chair, feet flat on the floor, take your right leg and slowly straighten your knee, extending your leg out in front of you. As you do this, point your toes toward the ceiling, then point them down toward the floor. You should feel a stretch through the back of your knee and into your calf. Hold the toe up position for 5 seconds. Toe down position for 5 seconds. Do this 10 times on each leg. What this stretch does is work on the hamstring muscles at the back of your thigh and the gastrocnemius muscle in your calf. These muscles cross the knee joint, and when they're tight, they pull on the joint in ways that increase pain and reduce mobility. By stretching them regularly, you're reducing that compressive force on your knee. The second stretch targets the quadriceps, that big muscle on the front of your thigh. You're going to stand next to a wall or sturdy piece of furniture for balance. Bend your right knee and bring your heel towards your buttocks. Reach back with your right hand and gently hold your ankle or foot. You're not trying to crank your heel all the way to your butt. Just bring it back until you feel that pulling sensation along the front of your thigh. Keep your knees close together. Don't let the bent knee drift out to the side. Hold this for 20 to 30 seconds, then switch legs. Do this 3 times on each side. This stretch is crucial because tight quadriceps muscles alter the way your kneecap tracks in its groove. Your kneecap, or patella, slides up and down in a channel on your thigh bone when you bend and straighten your knee. When the quadriceps is tight, it pulls the kneecap unevenly, causing it to rub against bone and cartilage in ways that create pain. By keeping the quadriceps flexible, you ensure smooth, pain-free kneecap movement. The third stretch is the one that surprises most people because it doesn't look like it has anything to do with your knee. It's a hip flexor stretch. Your hip flexor is a muscle that runs from your lower spine and pelvis down to your thigh bone. When it's tight, it tilts your pelvis forward, which changes the angle of your entire leg and puts abnormal stress on your knee joint. Here's how you do it. Find a sturdy surface about chair height. Put your right foot up on that surface, like you're doing a very low lunge. Your left leg stays straight behind you. Now, gently shift your weight forward, bending your right knee a bit more, until you feel a stretch in the front of your left hip and thigh. You might need to adjust your stance, move your back foot a bit further back. Hold this for 20 to 30 seconds, then switch sides. Do this 3 times on each leg. When I teach this to patients, they often say, "But Dr. Mitchell, I feel this in my hip, not my knee." Exactly. That's the point. Your hip, knee, and ankle are all part of one kinetic chain. When one link in that chain is tight or weak, it affects everything else. Tight hip flexors are one of the most common hidden causes of knee pain in people over 60. Now, here's the protocol I want you to follow. For the first week, do all 3 stretches once a day. Morning is ideal because that's when your joints are typically stiffest and you're setting the tone for the whole day. Each stretch sequence should take you about 6 to 8 minutes total. That's it. Not a huge time commitment. Week 2, if you're tolerating them well, do them twice a day, morning and evening. This increased frequency gives your nervous system more opportunities to reset and your muscles more chances to lengthen. Week 3 and beyond, continue twice daily, but start adding a little more challenge. Hold the stretches a few seconds longer. In the standing quad stretch, try to bring your heel slightly closer to your buttocks. In the hip flexor stretch, lean a bit further forward. You're progressively overloading the tissue, encouraging adaptation. Keep a simple log. I tell my patients to use their phone's notes app or just a piece of paper on the refrigerator. Each day, rate your morning knee stiffness on a scale of 1 to 10. Rate your pain during activities on a scale of 1 to 10. After 4 weeks, look back at those numbers. I'd bet significant money you'll see improvement. Here are the warning signs that should make you stop and consult a doctor. If you develop sudden, severe swelling in the knee after doing these stretches, if you have sharp, stabbing pain rather than a stretching sensation, if your knee gives out or buckles unexpectedly, if you develop numbness or tingling in your foot, those are signs that something else might be going on, and you need a professional evaluation. Also, and this is important, these stretches are designed for knee pain related to osteoarthritis, muscle tightness, and general age-related stiffness. If you've had a recent injury, if you've had knee surgery in the past 6 months, if you have rheumatoid arthritis or another inflammatory condition, you need to talk to your doctor before starting any new exercise program. This information is educational, it's based on current research and my clinical experience, but it's not a substitute for personalized medical advice. When you go to your next doctor's appointment, here's what I want you to ask. Doctor, are there any specific reasons I should not be doing gentle stretching exercises for my knees? Most of the time, the answer will be no, there's no reason you can't stretch, but occasionally there might be something in your particular medical history that requires modification. You can also ask, would you recommend physical therapy to learn proper stretching and strengthening techniques for my knees? Many insurance plans cover physical therapy for knee arthritis, and a good physical therapist can give you personalized instruction and make sure you're doing everything correctly. Here's what I tell every single patient who comes to me with knee pain. Movement is medicine. Not just any movement, but smart movement. Targeted movement. Movement that respects your current limitations while gently pushing you to expand them. These 3 stretches are your starting point, not your ending point. As your knees feel better, as your confidence grows, you can add more activities. Maybe you start walking an extra 5 minutes a day. Maybe you try a gentle yoga class designed for seniors. Maybe you get back in the pool for some water aerobics. Every bit of movement you add reinforces the gains you're making, builds more muscle, improves your balance, and most importantly, gives you back your life. Because that's what this is really about, isn't it? It's not just about pain numbers on a scale. It's about being able to play on the floor with your grandchildren. It's about taking that trip you've been putting off because you were worried about all the walking. It's about working in your garden, going to the grocery store without dread, climbing stairs without having to psych yourself up first. It's about feeling like yourself again. Margaret sent me a card last Christmas. Inside, she wrote, "You gave me back my knees, but more than that, you gave me back my joy." She included a photo of herself kneeling in her garden, surrounded by blooming flowers, the biggest smile on her face. That's why I do what I do. That's why I'm making this video. I want you to imagine something with me. Imagine it's 6 weeks from now. You wake up in the morning, and instead of that immediate stiffness and pain when you swing your legs out of bed, you feel Pretty good. You stand up without wincing. You walk to the kitchen without limping. You go through your morning routine thinking about your day, not about your knees. Imagine it's 3 months from now. You're doing that activity you commented about earlier, the one you've given up or cut back on. You're in your garden, or walking with a friend, or playing with your grandkids, and you suddenly realize you haven't thought about your knees in hours. They're just there, doing their job, supporting you, not demanding your constant attention. That's not fantasy. That's not wishful thinking. That's the reality for hundreds of my patients who've committed to these stretches and the broader principle of therapeutic movement. You can be one of them. If this video has helped you, if you're feeling hopeful about your knees for the first time in a while, do me a favor. Hit that like button so more people who need this information can find it. Subscribe to this channel because I'm going to keep bringing you research-based, practical information about taking control of your health as you age. And share this with someone you know who's struggling with knee pain. Maybe it's a spouse, a friend, a sibling. They need this information too. Next week, I'm going to post a follow-up video about the 3 most important strengthening exercises to do alongside these stretches. Because while stretching reduces pain and improves flexibility, strengthening is what really protects your joints long term. You're going to want to see that. Until then, I want you to remember something. Your knees are not broken. They're not beyond help. They don't have to keep you from living the life you want to live. With the right approach, with consistent effort, with a willingness to challenge the outdated advice you might have received, you can feel better. You can move better. You can reclaim activities you thought were gone forever. Your body is capable of remarkable things, even at 60, 70, 80 years old and beyond. You just have to give it the right tools and the right information. These 3 stretches are your first tools. Use them. Be consistent. Be patient with yourself. And watch what happens. I'll see you in the next video. Until then, take care of those knees and take care of yourself.